So if you were to get someone to name the two most common mental health issues, more than likely they're going to say anxiety and depression. Now, even though these are the most talked about in general conversation, people still misunderstand the difference between the two. And that's usually because people that are diagnosed with depression are also diagnosed with anxiety and vice versa. A lot of people with depression, they will also experience, along with their low mood and low energy, they'll experience something we call anxious distress. Now this anxious distress often presents itself as constantly feeling tense, feeling restless, having a deep worry about things that may happen to someone or themselves, lack of concentration, a feeling like they're losing control of themselves or a situation that's going on. And unfortunately, people with this often at a greater risk of suicidal thoughts, which makes it even more important to diagnose these symptoms along with the depression and low mood. Obviously, the symptoms of depression, the common one being low mood, lack of energy, and lack of interest in activities that maybe they once enjoyed doing but now no longer enjoy. The other one is increased or decreased appetite. Sometimes people use food to mask that negative feeling. So they use food to take that feeling away, to get a feeling of feeling good again, because food often brings us back to memories where we felt good. On the flip side, they won't eat anything at all. So often people with depression will shut themselves away. They won't want to talk to anyone, interact with anyone, or eat anything either. The other one is insomnia, lack of sleep. Okay, so they may have trouble thinking, having these worrying thoughts constantly going on in their head. On the flip side of that, we have hypersomnia, which is the just sleeping all the time. Sometimes, if you've ever known someone with depression, they'll often sleep for many hours at a time, just don't want to get out of bed, just constantly sleeping. Obviously, we have the lack of energy, what we talked about before, just not feeling like doing anything at all. Just don't want to be moving. Anything that involves movement often feels like hard work. Someone suffering with depression or anxiety. And obviously trouble concentrating is another common one. Concentrating on the little tasks that they do every day that someone that didn't suffer with depression and anxiety would find relatively easy. Someone suffering with this would find concentrating on the small tasks that we do every day very difficult. And obviously we talked about the suicidal thoughts that the people that suffer with anxiety and this anxious distress often feel. So often people that suffer with anxiety and depression, they'll go and see a GP, and more often than not, the GP will prescribe medication, which I've always been against, because why just cover the problem? You're not dealing with the problem. Why not get to the cause of the problem? Because something made them feel this way. Something caused them to have this depression, to have this anxiety. And why not go to a hypnotist like myself, where one session you can be rid of this depression, you can be rid of this anxiety. One session we can get to the root cause, and we can then rid you of the depression, of the anxiety, and have the effect being long lasting, so that you don't look back, you don't go back to those feelings, you move forwards and you rebuild your life from that point on. I think that's such a better way, such a kinder way of helping someone, rather than just masking it with medication. So hypnosis is a great way of interacting with the subconscious mind to get to that root cause, to get to the answers needed to deal with depression and anxiety.